So hello guys, my name is Abid. I'm a second MBBS student from Indira Medical College, Chennai. Being a fellow Plab aspirant myself, I'm pretty sure this is going to be an exciting webinar and most of our questions are going to get answered as well. So can't wait to start.
Good evening, all. I'm Bala, second year MBBS student from Sri Siddhartha Medical College. Really honored to do this session with you, sir. Hi, everyone.
Hi, thank you.
So everybody, we are joined by Dr. Surya, who did his MBBS from Meenakshi Medical College and Research Institute, who cleared his Plab in the very first attempt and is now working in Cambridge Hospital as an internal medicine trainee. It's an honor to have you here, sir.
Thank you. Sorry, I think there's a audio lag.
Okay.
No, it's okay. It's okay. I think it's my side. It's all right. I mean, it's Teams. I'm pretty much happy to answer anyone's questions. I have done this route a few times now. I've been working in the UK for 4 years, and I've seen a lot of people go through the same process over and over again. So I have done a few meetings and webinars where I had to go through the basics of what Plab is and how do you apply and get into Plab, and then I get asked questions and then the questions keep following up. So I thought we'd rather do a session where I could clear the questions and clarify whatever doubts you might have regarding working in the UK.
Okay, sir, that sounds great. So we can start with the questions as well?
Yeah, sure.
Okay. So we have the first question is how to register a new college with Ecfmg and get GMC registration. So when you see a new college, how do you register it?
So so I just want to make sure I understand the question correctly, because there are two ways. So the first thing is, before you attempt Plab, you yourself have to register with the Ecfmg, not your college. Okay, before you register yourself to the Ecfmg, your college must be on your approved medical college list. Okay, so it's your college's duty to be accredited by the Ecfmg or be in the list of Ecfmg approved medical schools, so that you as a student can put in your name and get an Ecfmg approval. So what Ecfmg is, Ecfmg is nothing but an organization which accredits your medical degree, stating that there is no fraudulent degree. There have been reports where people go to the UK and the US and other countries with fraudulent medical degrees. So they will ask your medical school to either email or post or courier a copy of your medical transcripts as well as your diploma, and then confirm that you are a medical student in an approved med school. That is the process of Ecfmg approval. In terms of your college getting approved by Ecfmg, now that is a different process. Yes, some new and upcoming colleges will not be on the Ecfmg list, and you don't have to worry about it. So Ecfmg uses an organization called WFMG, World Federation of Medical Colleges. Okay, and there are so many millions of medical schools in that list. First, as a medical school, it is the duty of your dean and the department to put your name onto the list of WFMC. Okay, and then after that, you will be able to sign on to Ecfmg. The whole process of your medical school applying and getting an Ecfmg accreditation should not take more than a month. Okay, when I was applying in 2011, 12 something, when I was looking towards Plab, my medical school was not in the World Federation of Medical School list. So I sent a personal email stating that our medical school is actually registered to the Tamil Nadu Medical Council and we are actually a real medical school. And then this was followed up by the dean and the HR team, and then it was accredited in a month or two. So it's not that big a deal. But that is the first step. That is the first step. You have to do that before you do anything else. This is not only for Plab. This is to go to Australia, Dubai, USA, anywhere. Ecfmg is needed. Ecfmg is an American organization, not a British organization. So it's sort of central for all the countries.
Thank you, sir. When should we start preparing for everything, and how to prepare ourselves day by day to finally land a job?
So that's sort of a subjective question because it depends on everyone. Whenever you're ready, you can start. But ideally, what I would recommend is not to start when you're in medical school. Okay, that you'll be too early and you wouldn't know what to do. That is a reality. And you need some experience. Not when I say experience, I meant internship experience. So that experience is needed to definitely prepare for the exams, especially Plab 2. So I would suggest thinking about USMLE. Thinking. When I say thinking, I'm not saying that you begin it. Think about it during your internship, not before that. There's no point in thinking about. You can obviously get as much as information about it, but I would say not prepare until you're at least in the middle of internship. So you have to go through Ielts, OET, and then prepare for Plab, and then Plab 2. So this is a process which needs a lot of time from your side. And as a medical student, you will not have. Even as an intern, you will not be having this time.
Okay, so like we have the next question. What are the different levels of training in the UK along with the concerned examinations like MRCP, MRCS, FRCP, FRCS? Like what exactly are these examinations and what are the levels to training?
Right. So let me first talk about the levels of training and I'll compare between India and the UK. So in India, you finish your medical school and then you do internship, 1 year internship. In the UK, this 1 year internship is split into 2 years. Okay, so people do the 2 year compulsory internships. So foundation year 1, and they are called foundation year 1, foundation year 2. Okay, just like when you're doing your internship, you're only provisionally registered. In the UK, students who do foundation year 1 are only provisionally registered. Only people who apply to foundation year 2, only when they go to foundation year 2, they get professionally and fully registered as a doctor by the General Medical Council. So those are the 2 steps of internships in UK. After you do the internship, then you apply for specialty. Just like in India, you don't have to directly go to specialty. A lot of students, a lot of doctors actually, after doing their I'm going to refer to foundation year 1 and 2 as F1 and F2 from now on. After completing their F2, they will take a year off. They will work another year. They call that F3 year. You can call it whatever you want. And then they look at applying for specialties. So specialties, obviously, surgery, medicine are the two main specialties, and obviously pediatrics, ophthalmology, emergency, all of that is there. So you have an interview, and for certain specialties, you do have an exam. It's called MSRA, Medical Specialty Recruitment Exam or Assessment Exam. So you prepare for that exam, you take it, and then based on your score and your interview, wherever you get placed, you can start your specialty. For internal medicine, there is no such exam called MSRA. But ideally, to get an internal medicine post, to get an internal medicine training post, MRCP Part 1, at least, if you have that in hand, you can easily get in internal medicine. In terms of the exams, MRCP obviously is for medicine, MRCS is for surgery, and then there's also pediatrics, MRCPH, and then there's also emergency medicine, and there's also anesthetics, MRCA. Okay, it is not that just by doing MRCP, it means that you're a specialist. So imagine you're doing internal medicine somewhere in India. So the post is for 3 years. In UK now it's being made 3 to 4 years, depending. At the end of 3 years, you will get a certificate called CCT, okay? Certificate of Core Training. That's called, so in UK it's called IMT, Internal Medicine Training. The certificate you get is called Core Certificate of Training, Certificate of Core Training. That is equivalent to the MD degree in India. Okay, now you're an MD. To get that MD degree, you have to pass the MRCP exams. So just by passing the MRCP exams, you cannot become an MD. You have to pass the MRCP and do the 3 years. While you're doing the 3 years, just like you have a logbook as an intern, you will have a 3-year logbook with certain number of procedures, cases, outpatients you must see. You should get these logbooks. It's an electronic logbook. You'll maintain it online. Your doctors will sign up. Your supervisor will keep looking at the logbook every now and then. And only after you see all of those cases and you pass the MRCP on time, you can get the core certificate of training. Depending on whether students don't pass MRCP or not, they're in the first attempt or not, your internal medicine training gets going on and on and on. You will not be kicked out of the program if you fail. There are so many failures in MRCP. In fact, it has only a pass rate of 40% or so. So people keep attempting them again and again. The same is for MRCS. The same is for MRCE. So you will get a core surgical certificate, CST. Okay, as after you do your MRCS and finish the 3 to 4 years. That means your MS. But unlike in India, you cannot directly do orthopedics in UK. You have to do surgical training as then progress to orthopedics. And even to go to orthopedics, you need MRCS done. Okay, orthopedics is sort of a super specialty. Surgical training is long in that first you do 2 to 3 years of surgery. Okay, and then you apply for super specialty in surgery. So while you apply, some people gain more experience because it's not easy to get into super specialties, right? So because the seats are low, just like in India. So they'll get some more experience on whatever specialty they're like, and then they'll start applying for programs. For programs, you need your MRCS and then again your interview and some research audits while you're doing your surgical training for you to get in. That's it. I can see that someone's raised their hand. I don't know who that is. AU, are you able to see that?
Yeah,
yeah,
called Icmr. Yeah.
Oh, right. Are you? Do you want to ask a question or anything, Ashik?
Maybe you can drop the question on the chat box. You can look into it later on.
Yeah.
So you can continue. Yeah. Like if anybody has questions, can you please put in the chat box? Yeah. Is that fine? Okay. Yeah, we can go on. We can go ahead.
Yeah, so that's the training. So after you do MRCS, MRCP, you finish internal medicine, then you apply for super specialty like respiratory, cardiology, nephrology, and then you do subsequent years of training there. Cardiology is 4 years, nephrology is 3 years. Depending on each specialty, super specialty, everything is different. And then, so in UK, the norm is while you're doing your specialty, you also choose your super specialty. While you're doing cardiology, you choose whether you want to be an interventional cardiologist, electrophysiologist, or echocardiologist, whatever you like. And then you finish the super specialty training as well. Nowadays, most training positions, including surgery, after you finish your initial MD/MS degree to pursue super specialty, people do a lot of people are doing PhDs because it's hard to get consultant posts. So in India, you will become a consultant after your MD. You can treat yourself as a consultant after an MD. In UK, you can. For that reason, not in many countries, you still cannot call yourself a consultant. You have to be a specialist at least to call yourself a consultant. But after you finished your super specialty in UK, like let's take my example. If I finished my internal medicine, then I applied to cardiology. I finished cardiology. It will take 3-4 years, and then I do some research for 2 to 3 years, either a fellowship, a PhD, or whatever. After I do that degree, then I have to apply for hospitals to take me as a consultant. Then I can become a consultant. There's not a lot of private practice in UK, but there is some bit of competition, and they'll have to make a space available for you when you're a consultant. That is a long picture in UK.
How to go about doing research, clinical attachments, audits to strengthen your CV?
So research, obviously, you can do it anytime. You can do it in medical school, medical college. Any type of research you do is valuable. To get into UK first, it doesn't matter what type of research you do, as long as you do research. That's it. Okay, it's not as important in the UK as important as it is for the US. Okay, in terms of clinical attachments are basically internships or electives you do for a month or two in UK. Not necessary, but some people do it. Yes, it could give you an advantage, but not too great an advantage. Nowadays, if there are, so wait, I can give you an example. So when I was working in a hospital, there was this young girl who finished Plab and who just wanted to start working in the UK. She couldn't get a job, so she reached out to the consultant individually. So you have to be done with your Plabs first to do clinical attachments. Just letting you know. So while they're doing their Plab, or after you're done Plab 1 at least, they reach out to consultants in the UK, and then they ask them like, I want to observe working with you for a week or two. While you work with them for a week or two, you can get to know the consultant. And when you apply for the position, obviously you'll get an interview. That is the whole idea of a clinical attachment. But it depends. For example, I didn't do a clinical attachment. I don't know a lot of people. I've been there for a few years now, and I've seen hundreds of doctors come in. I have not seen a lot of people do clinical attachments. It's a 1 or 2 case basis. It's not going to give you a big upper hand, but it's also not going to give you a big disadvantage. So you don't have to worry about that. Audits are usually done in the UK while you're doing clinical attachment. So an audit is different in, I'm not sure if everyone knows what an audit is, but for those who don't, I'll just give you a quick recap. An audit is something you observe and conduct in a hospital for a specific guideline or procedure they are supposed to follow and to see how it is being followed. For example, if there is a treatment for myocardial infarction, within 90 minutes, all the heart attack patients who come to the hospital must be, if they're STEMI, they should be referred for a PCI. If not, they should be thrombolized if it's going to be taking 120 minutes, right? So if you want to do an audit, what you would do is I'm going to check whether all the patients who come to the emergency department with chest pain and positive STEMI or NSTEMI picture on ECG are being given the 90 minutes treatment or the 120 minutes treatment appropriately. And you will observe like 100 patients are coming in and you'll say 90 minutes, a patient's been waiting for 3 hours and we still haven't been giving them treatment. Patient's been waiting for 4 hours, we don't know what to do with the patient. So you record all these and then you publish this to the hospital. You're not publishing it into a journal, you're presenting it to the hospital. Once you're presenting it, you also offer solutions like, no, we have to improve the timeline, we have to reduce the supply chain, we have to reduce this, shorten the length of the cycle it's taking for us to do all of this. And then you re-observe the audit. You redo it after you've given your solution. You do it to see whatever solution you've given has actually improved patient outcomes. So if previously all the PCIs were being done within 3 hours, now if the PCIs are done within 1 hour or 1.5 hours, good thing, you made a change. That is the audit. Okay, you can also do it in your own hospital. You can even do it in India, but it's not being done at all. I don't even think audit is a thing, and I'm not sure. But at least in Tamil Nadu, from what I'm aware, not a lot of people do audits. Yes, in UK, it will be helpful if you have an audit. It's not like clinical attachment. Okay, audit will give you some level of advantage. So ideally, what I would suggest is if you are definitely confirmed and then you want to go to work in the UK, complete your Plab 1 and Plab 2 or just Plab 1. Some people, after your Plab 1, you definitely have to go to UK to attempt Plab 2. So during that time, you can apply for clinical attachment. While you're doing the attachment, you can ask the consultant, like, I want to do an audit. No one ever says don't do an audit because they like it. Okay, so you'll do an audit. And then there are small audits. You can finish an audit in 1 week. You can plan an audit for a month, depends. Okay. And then get the audit done and then apply for interviews. The benefit of doing it in UK for an audit is you can get a consultant sign off, a UK consultant sign off on the audit, which actually increases the legibility, people will believe you that you've actually done an audit when you apply for interviews. An audit will give you some sort of advantage, no doubt in that. It always will, because it's a requirement. Nowadays, to go to UK, it's a requirement to do an audit, from what I understand, for the UK medical graduates. So it's better you do an audit.
Okay, so moving on. How much does the Plab pathway cost? That's one question. Then how long will the whole process take? Like how long does it take to finish the whole process? And then including the visa process as well, like the visa processes, how long will it take for the entire Plab pathway to get over, and then the costs of each and everything. Yeah.
Right. Yeah. I'll just answer this question quickly. In terms of MRC, OG, someone's asked what is MRC? MRC is Medical Research Council. Okay, that's used for doing PhDs, whereas MRCP is Member of Royal College. Okay, these are two different things. MRC is to do PhD. MRC is Member of Royal College of Physicians, Member of Royal College of Surgeons, ophthalmologists, obstetrics, and gynecologists, and that's what MRCP means. But generally, when you apply for only when you apply for PhDs you need MRC. Sorry, in terms of the cost for the Plab and the visa process, let me begin with the visa process. Obviously, you'll only begin the visa process after you're done your Plab 1. You're not going to do it now. It's going to take a long time. Okay, all you need is a standard visit visa. You can, in the standard visit visa, you can say that you're going to take Plab 2. People don't say that, but you can still say that because around 10,000 students come in a year just to take Plaque 2, so you can take it. Okay, minimum. I think so. Please don't take my word for it, but sure. And also, in terms of the cost of the visa, I'm not sure of the exact visa fees, but I would please assume that it will be between 1 to 2 lakhs just to get the visa. Okay, and the ticket book. Okay, I understand that there is a catch, is that there must have been some account balance for you to survive in the UK for the visa limit, so which is a month or 2, and that has to be in the bank account, either your beneficiary, which means your parents, or someone who's close to you is going to sponsor you their account, and only then they will your visa will be approved. And this money should have been in your account for the past 1 or 2 months minimum. So you can't just, if you have a visa appointment tomorrow, you can't transfer money from your relative 2 days ago and can you just transfer 2 lakhs into my account? No, that will not work. That money has to be in your account for at least 2 to 3 months, okay, before you apply for the visa. So then you'll get approved. Because why I'm specifically stressing this is there are so many rejections in the visa for this reason. Okay, not for other reasons. You will not be rejected a visa to go to UK if you have a bank account to support you there. That is the main reason people get rejected. And then you book your ticket and then you book your stay. So in terms of UK pounds, it's easier for me to explain. Just assume 1,000 UK pounds is 1 lakh rupees. Roughly, that is the going rate. Okay. So in terms of the UK pounds, the whole process of getting a visa and supporting yourself in UK for around 1 to 2 months will cost you 3,000 to 4,000 pounds. Buffer 4,000 pounds. This is the reality. This is what will happen. Yeah, 4,000 pounds, including your visa application, your travel, and supporting yourself in the UK will take 4,000 pounds. 4,000 is actually a lot. You can easily survive.
Which is the best resources to prepare for Plab 1 and 2, sir? How much will the Plab pathway cost on approximate?
Right, sure. Obviously I'll deal with the cost first because we were discussing about it earlier on. The Plab pathway, just to get a visa and being there 4,000 pounds. In total, I think will only be 4,000 to 4,500 pounds. If you time it right, if you do it perfectly, it will not go more than 4,000 pounds. Okay. And obviously you can make that money in 2 months after you start working in UK. Anyways, in terms of the resources, there are so many resources available in Plab. The unfortunate thing is that there are no cutthroat, like this is the resource I need to read and I'll do well in Plab 1. No. What I did 4 years ago, I will tell that. Maybe it might be helpful. So 3-4 years ago, there is this question bank called 1,700 question bank. A lot of people know about it. It's available everywhere. It's free. Facebook. You'll get 1,700 question bank questions with MCQs. All the Plab questions will be based on the same themes. However, when I wrote it, our first exam was the demo of UKMLA. So the pattern was a bit different. So even though they call it Plab, the pattern has already changed and it's very similar to UKMLA. That's what they were going for. And someone's actually asked a question about how different the prep will be. So this should also answer the question. So UKMLA is obviously like USMLE, longer stems, but it's still the same. Not that big a difference. You can still answer the questions. So why I brought this 1700 questions is what I did. There was 1700 questions to go through, and they were all MCQs. All you have to do is read the question, learn the MCQs, read the topics behind each and every choice. That's all you need. That is all you need. And to help you in these preparation, there are two books: Oxford Handbook of Clinical Medicine, Oxford Handbook of Clinical Specialties. For Plab, you don't need to read the books. Okay, you don't have to know the books in and out. All you need to know is the MCQs. All you need is question taking skills, multiple choice question taking skills. There are some mocks available. There are some courses, Samson mocks. There are free online mock questions and tests available. Do a lot of mock tests and just the MCQs. Read the topics behind the MCQs. You'll be fine. Ideally, the preparation should not take more than 2 months or 3 months if you want to be really prepared. 2 to 3 months is more than enough to prepare for the exam.
Okay, sir. So like, when should we create a GMC account? What is epic verification?
So epic verification, I'll discuss about it first, because epic verification is same Ecfmg verification. Okay, Ecfmg uses an organization called Epic to check your medical degree. Okay, so when you register for Ecfmg, what you actually mean is getting verified by Epic. Okay, so basically what happens is you will send your med school will send your medical degree to Epic, and then, so when I say Epic is the same as Ecfmg. Ecfmg hires Epic to check your credentials. That's the difference. Okay, so you will just verify your credentials and you can start applying for Plab and stuff. That is Epic. Okay, and creating a GMC account, you can create it whenever you want. Doesn't matter. You can even create it now. That has no bearing. You can create it before you take Ielts. You can take it after you take Ielts. It's not going to make a difference at all. So when I say GMC account is an online account like Facebook account. That's it. You created Facebook account. That's it. You'll have an account, but you have to be done with Plab 1 and Plab 2 to register yourself with the GMC. Now that is different. After you do Plab 1 and Plab 2, you have to submit your Tamil Nadu Medical Council or each state medical council verification, not Indian Medical Council, state medical council. I'm being specific. State medical council verification, your internship certificates, your logbooks, and your medical degree, and upload it online or an interview in UK, and then you will get yourself registered with the GMC as a doctor. But even before you do Plab 1, you can create an account and you can keep it. That's different. Then you have to pay the registration fee, is around £400. Registration fee per year. That keeps recurring. Whatever you're doing, if you want to stay inside the registration council, you have to keep paying £400 every year. Just between each and every question, I'm just going to go through the question in the comments as well. Is that okay? Between one of your questions, is that okay? Yeah. So someone is asked, what is the difference between doing specialty in medicine in India and abroad? Well, I don't think. I don't know what specialty. I don't know what what kind of difference you're expecting. Difference, obviously, your training will be a little bit better. Yes, your training will be better because you will have more supervision. So in India, there's less supervision. You'll be working more independently, which could be good. In UK, you'll have more supervision and you'll have more training to progress through everything. There are some set pathways. For example, if you work in a hospital in India which doesn't have a lot of lumbar puncture patients for lumbar puncture, then you will not do lumbar punctures, correct? You cannot get the experience. In UK, any medical degree you do, there are certain amount of lumbar punctures you must do every year to progress to the next year. So that is what I mean. So in terms of the training of lumbar punctures, you will definitely get it because you keep doing it every year. You will keep doing suprapubic catheters. You will keep doing certain procedures. That will be the difference. In terms of specialty, specialty in medicine in India and abroad, there is literally no difference. You will be a good specialist there and in India. Okay. When you ask for difference, if it's quality in training, both doctors are good. In fact, Indian doctors can sometimes be better. Okay. But there's no difference. I wouldn't say there is a big difference in my time there.
My question is same, sir. What types of specialties that are open to IMG job processing, and what type of job to pursue first, like training or non-training?
Every type of job is open for IMGs. There's no bias. Anyone who says that there's a bias is wrong. Is downright wrong. UK will give equal opportunity if you are experienced anywhere. So I don't think there is a problem there. In terms of what to pursue, I would suggest pursuing a non-training job, but there are events where you can also do a training job directly. But nowadays the scenario is shifting. IMGs who come to UK cannot directly get into a training job. There's a long answer to this. So Plab 1 and Plab 2, you finish it, you register with the GMC, and then you have to write an exam or apply for interviews and put in an application for internal medicine training. When you put in the application for internal medicine training, just like you have an internship certificate in India, in UK, students will have an internship certificate called Foundation Certificate of Training, Foundation Competence for 2 years. You won't have that. Because you don't have that, you cannot apply for training. That is a rule currently. They changed it last year or the year before. So for you to get the foundation certificate, you don't have a job in UK, you don't have any experience, but you're applying to training which you can get into without a foundation certificate. So nowadays, the ideal path is to go for a non-training job. Non-training job is just like applying for a senior resident or junior resident after you finish your internship. In India, you do the same in UK. Okay, but you'll get paid the same salary, whether you're a trainee or a non-trainee. The salary will not be different. While you're doing that, you can tick, just like you have a logbook here, you'll have an electronic logbook in UK. You will finish all the training requirements, do these many venal punctures, put some urinary catheters, internship stuff, okay, and then get that signed off by the consultant. This will take minimum 3 months. Once you do that, you can apply for training, which is also advisable from my side, because training is very different in UK. Unlike in India. In India, you finish your residency and you directly jump to training and you don't know a lot of stuff. Reality, that is reality. You train only during medicine in India. But in the UK, the foundation graduates are very, very competent. They can treat a STEMI on their own. They can treat an NSTEMI on their own. So if you do a non-training job, you'll be exposed to the system and you will learn more about how the things work in UK and then apply for training jobs. It will also give you an upper hand because wherever you're during a training job, you will know who the program director is for internal medicine. You can develop a rapport with them and then you can get a job during the interview. It's highly possible. I'm just going to cycle. Is doing a specialty in abroad in US and UK worth it? I kind of explained it before, but worthy being not worthy depends on your choice. Okay, yes, it is worth it if you want to go there. The quality of training is good if that's what you're asking about. In terms of monetary compensation, yeah, not bad, really good. That's it. In terms of worthiness, that's very subjective. But quickly, is Plabable needed for preparation? Yes, a lot of people use something called Plabable. It has a lot of MCQ questions. Obviously, the more questions you read, the more helpful it is for you during the exam. There is no cutthroat. There is only one resource for you, Plab. Unfortunately, there's not. If you go to US, yes, there is UWorld, First Aid, and everything. In UK, no, there isn't. You can do as many resources, but the most recommended path is 1700 questions, Plabable, Samsung marks, and then take the exam. That's it. And someone asked, do we have the freedom to choose a specialty of our choice after completing Plab 2? Depending on your job, yeah, you can apply to any job you want. Pediatrics, orthopedics, ophthalmology, surgery, anything you want, and you can get that job. Okay, well, obviously, if you pass the interview, you can get it. My recommendation
is somebody who wants to.
Yeah.
I'm sorry, please go on, sir.
My recommendation is to choose a job where you can do a multiple specialties. There are positions like that. I did something like that. So when you work for 6 months or 7 months, they will rotate you across different specialties, just like an internship in India, but you will get to know about a lot of specialty in a shorter time.
Thank you, sir. Overall life in the UK, racism, salary, finance, management, and what do you
Well,
think?
finance and management is up to you. You will get remunerated as per your job. I don't think there will be an issue. But in terms of quality of life, it depends on what you compare it to. If you ask the weather, it's cold there all the time. Most of the time, it's raining. If you like it, you'll like it. If you don't like it, you won't like it. That's based on personal preference. In terms of housing, you'll be fine. Well, with whatever you will be compensated on a per monthly basis, you should be fine living and working in the UK. In London is a different story ball game altogether, because London is one of the most expensive cities in the world. So even on a doctor's salary, even on a resident's salary, registrar's salary, it will still be difficult to get your own place. You might be living in sharing accommodations with other students or doctors. That's a common thing with London. But if you move out of London, you should be able to get your own place, rent it, and live. I wouldn't use the word racism because depends. So Indians are trained in a different way. We live and work, and our culture is different, and we have to appreciate that British people are also live and work in a different way. And there's obviously going to be that difference, which might make you feel discriminated. But I don't think might have been a thing of the past, not anymore.
So, if it's somebody who wants to settle in the UK after they finish their training, which pathway would you recommend? Like Plab pathway or the MR, or the like after doing PG in India and then moving back to the UK? Which
So
one do you
ideally,
think is the best?
it's better to go early on, because obviously the people I saw who had done their MD or MS in Pakistan, India, Israel, Iran, they are not happy in UK. Not very much, because the training is longer. You have to. It's a long circuitous path. It's competitive to get into super specialty if you haven't finished your specialty in UK. It's competitive to do the non-training path towards being a consultant. It's quite difficult. So I'm not saying it's impossible. It's based on personal preference, but obviously it's advisable to go early if you plan to settle in UK. It will make your life a little bit easier. And someone's asked, do we have the freedom to choose? No, I've answered that. Is Plab 2 based on practical skills? How to prepare for it? Yes, Plab 2 is based on practical skills. People who go and attempt Plab 2 usually take some courses there. There are several academies, Samson, Swami's, Hamad, a lot of academies. You go there for a month, they will teach you how to deal with patients, how to interact. It's a bit different. Your communication needs to be perfected. And then you apply for the exam, and then you take it. So people usually apply for Plab 2 exam, go 2 months before the exam, take the course for 1 month because the course is 1 month, and then prepare for 1 month and take the exam, one shot. That's how it works. Is it difficult than Plab 1? Yes, no doubt. It is difficult. You have to prepare for it, obviously, because you're going to be dealing with real patients. No, sorry, not real patients. Actors who act like real patients. Then you'll have something called Sims stations. These are like mannequins who are active. They'll have a chest pain. Mannequins will have an ECG, pulse, and everything. So you have to learn your way with mannequins. So they are quite a bit tricky. Like, how do I put a stethoscope in a mannequin? You have to put venous cannulation into a mannequin and all of that. So that requires some training. So yes, courses are recommended to do this.
How to get into research as an MBBS student, sir?
What do you mean get into research? Like, you can do research even in med school.
Yeah, how we can approach?
So it depends. Like, I have no idea. So if you want to do research, you apply for a research position in UK. You do a master's. I did a master's. I did something related to research. I wanted to do research. I did master's. Not everyone does it. I'm one of the rarities. No one does what I did. It's very rare. Okay. You can do research in India. In UK, you can just do research while you're working. You can still do it. And when you're doing research, if you want to do a PhD, that's where the MRC comes, like Medical Research Council. You apply for funding. If you're doing a clinical research, you apply to the MRC, and then apply for funding, and then start applying and doing research. Depends. It depends. There are so many ways for doing research. That's probably why I'm not able to answer. You can do it without studying. You can do it while you're working. You can do it while you're doing a PhD or a research position. You can do a research fellowship. You can do any of these. And I'm just going to quickly cycle through this. Are electives necessary? I answered this before. Not really necessary, but well, obviously they will give you an advantage, but they don't keep you at a disadvantage. That's what I'm telling you.
So like talking about English proficiency, like English proficiency tests, OET or IELTS, which is more recommended for a medical student?
So that's a bit tricky because I took the Ielts. I know a few people who were not able to clear the Ielts in the first go. So the Ielts is a 7-band exam, and for each medical, like for nursing, you should score 6.5 in each band in Ielts. For medicine, you have to score 7.5 in each band in Ielts. So that's how it works. More than 7.5 at least. The tricky bit is the writing bit of Ielts. No one knows why writing doesn't work out. I'm not sure why. I've seen a few people, have some difficult scores only with the writing. I have heard, I have not personally taken OET. I have heard from several people that the OET makes it look much more easier, and it's sort of directed towards medicine. So OET is the Australian English test. Of course, it's by the Australian, English community. So you can do OET as well and get it done. It works. I've heard that the OETs will, the result and the test process is longer though. Don't take my word for it, but that's what I've heard. You can take IELTS or OET. From what I have heard, OET takes less preparation than IELTS. I have also seen people have no preparation for IELTS or OET and pass both the exams. So it's very subjective. It's based on your English communication skills. Are there any courses and any colleges which we can pursue a medical field along with a non-medical field? Non-medical field, what is it? What is a non-medical field? If you can give me more context, then I can answer that question. How much do these 1-month courses cost? 1-month courses will cost minimum £700, but you will also be paying for staying in the UK during that time. So add in at least £1,500 to £2,000. Non-medical field like political science, you'll be doing a past master's. Then you'll have to apply for your master's degree and do it. Well, if you're doing a complete non-scientific degree, like a non-clinical or non-medical degree, you will have to apply for a master's or do it on the part-time. You can do it part-time. Yeah, it's allowed. While you're working, you can do it.
So why did you do an MS in UK?
Because I wanted to do research. I applied and I wanted to learn a bit more research. You don't get exposure as much in India.
Okay, so like, do we need a letter of recommendation from consultant? Like, for example, if you know somebody who's working as a consultant in the UK, can you approach them? Like, can you get a job through them? If you have a relative, somebody who's working there, can you approach through them to get a job?
You can probably get an interview. I didn't know anyone. You can probably get an interview, but obviously, how you do an interview is based on your professional experience. But you can obviously get recommendations in UK because you will have to submit references and everything. But even for you to apply for a first job in UK, you have to give references from India. So yeah, references will help, but it's a very standardized, straightforward process. It's not like someone has an upper hand versus another person. Yep. I'm just going to answer one of these. Can we give Plab during internship? I think there's a bit of discrepancy, yes. Yes, you can give Plab 1 during internship, but make sure you have to do your Ielts or OET before that. So it takes a bit longer. You can do Plab 1 after completing our internship. I advise taking Plab 1 after you complete your internship. It's my personal advice because someone's actually asked me that. What next?
That's all the questions we have so far. Does anyone else have anything to ask? Please drop in the comments.
So there are a few more questions. So who exactly is a consultant? The one who took Plab after undergrad or then MRCP? It's something like MD, MS in India and then super specialty. So it is complicated. You're right. In India, after you're done your MD, you can call yourself a consultant. In UK, after you finish your internal medicine degree, you will be a registrar. Okay, a registrar is not a consultant, but almost a consultant. Okay, you will be treated like a senior doctor. You are a senior doctor because you finished internal medicine. So you first finish your MRCP, MRCS, get your training certificate, then you apply for something called a consultant position. So just like you're applying for senior registrar position in India or junior registrar after internship, you have to apply for consultant position after you finish your super specialty training. And only when you get that position, you will be called a consultant. Until you get that position, you are a registrar, but people will know that you're a consultant level person. Does a gap is a gap year considered as a red flag? Depends on what you do during the year. If you just waste it, you will not have anything to say about it. If you go on a holiday or a vacation for a year, yeah, of course. I don't think it will be considered a red flag. No one considers that. A lot of people do that. And if you're working somewhere during the gap year, it's fine. Even if you're working for 3 years after your graduation and still apply to Plab, it will not be a disadvantage.
Sir, somebody has asked us to like summarize the whole process, like from after finishing internship in India to becoming a consultant. Like what is the step-by-step process? Just to like summarize the whole thing.
Okay, so first you apply for Ecfmg or EPIC verification while you're doing you can either do Ielts first or do the Ecfmg first, or you can do both hand in hand. Okay, pass the English exam and then get your Ecfmg or EPIC verification. See, just because you have your Ecfmg verification does not mean you can work in UK, because someone's asked that question. You need to finish your Plabs and get registered with the General Medical Council. EPIC is a verification of your medical degree, Ecfmg and EPIC. When I mean EPIC, I also mean Ecfmg. Both are almost the same. So then you apply for Plab 1, prepare for the exam, take Plab, and then either you can have a UK visa already or apply for the UK visa. A lot of people take some courses. A lot of people take courses in the UK for Plab 2. So you can apply for one of these courses. I have heard that those courses have now also been are also being conducted in India. So maybe you can also take the courses in India. Go to UK, take the Plab exam. The day after you pass the Plab exam, I think the results come in 4 weeks or so. After you pass the exam, you can apply for GMC registration. Depending on how busy the process is, it could take from 1 month to 3 months. And then you can apply for jobs. So applying for jobs, you don't have to be in UK to apply for jobs, but some people prefer to be in UK. They apply for jobs in UK. Some people come to India, apply for jobs, attend the interviews, and then get a position and leave there. Obviously, before your Plab 2 or after your Plab 2, you can do your clinical attachment while you're in the UK. That's it. What specialties are easier for Indian medical graduates to match into? Internal medicine is the easiest. GP is easy. I've heard pediatrics is easy. Yes, it's easier for for anyone to match into, not only Indian medical graduates. Can we practice in UK with Ecfmg certification? No, we cannot. You need to finish Plab 1 and Plab 2 and then get it registered with the GMC. Do Plab scores make us eligible for working in the Gulf countries? Yes, they do. If you finish your Plab, you can start working in other countries. I think Qatar, Dubai and stuff. Other countries, you can. How easy is it getting a job? It's very variable. I have not seen anyone not get a job for more than 6 months. I have not personally seen, but there are stories. Um, after you finish Plab 2, get registered with GMC, you can start applying to jobs. I know several people just after finishing Plab 1 already have jobs. Those jobs you can obviously start working after you finish your Plab 2, but they already attended interview before their Plab 2 exam and they passed it. And then after the Plab 2, they'll just start working. You can start working there. In terms of how competitive it is, you can get jobs in UK. It's not hard. It's not hard. It's not difficult for anyone. They need doctors. Everyone needs doctors. But obviously, it also depends on your professional experience. If you're really good, no one's going to say no to you. Do Plab scores, how easy is it getting a job? Yeah, I've answered that. How many attempts is it possible to clear in Plab? It depends. 1 attempt is enough. 2 attempts is also enough. But maximum, I think, is 4 attempts. Are there seat limitations? Yes, there are seat limitations, but seats are available. From what I understand, there are many leftover seats, especially in internal medicine, every year, because people don't take the positions. Tell us about the surgical program in UK. Surgical program in UK is a bit competitive. That does not mean that it's competitive only for international graduates, no. So for surgery, you need to have a lot of experience in UK. So people, while they're doing their non-training job in UK, gain a lot of surgical experience in a non-training surgical job. And those who apply for training with that experience, they do get into surgical training. So it will take, the difficulty is in terms of the time getting into surgical program, in my opinion. After you put in that experience, some people also take MRCP even before they are applied to surgical program. That'll give you an upper hand getting into training. They'll finish their MRCS and then they'll apply to surgery. You can do that. You can finish MRCS and also apply to training. Is it possible to do dermatology or cosmetology super specialty? Yeah, it is. Dermatology is competitive, just like anywhere else in the world. You just have to prepare and then apply for super specialty with dermatology. What can I do now as a final year student to prepare for the Plab and UK journey? Look through the Ecfmg EPIC verification process. Start working on English exams. I think that's what you should do. And it's all depends, because the Ielts and OET, I think they're only valid for a year. So if you take them very early, they'll expire and you'll have to take them again. So don't take them until you have to actually take Plab, is my recommendation. If you don't mind saying, can you say how exactly you were preparing during your undergrad and what you did in the UK? I didn't prepare anything during my undergrad. I was working in Apollo after medicine. That's when I gave Plab. So, and I think that's what you should do. But what all did you do in the UK? I worked in the UK. I did an MSc for a year, and then I worked in the UK as a doctor in internal medicine. I worked through various departments: cardiology, respiratory, emergency, acute medicine, hepatology, transplant medicine, liver transplant, kidney transplant, palliative care, all of that. I've worked in several specialties. Is this necessary to do Icmr projects or other research papers? It's not necessary, but it's obviously very good. If you have that, that's very, very good. It helps you in training jobs, because the process of applying to training jobs is based on points. You'll be scored. Like if you have research, you'll get 2 points or 10 points. If you do publication, there are certain points. Projects, audits, several points. So research area, you'll have more points. Is applying to a non-training job after the Plab same as FY2? Yes, it is. You are correct. FY2 is correct. You will be a foundation trainee. You cannot become a registrar because you have not finished MRCP or MRCS. If you have finished MRCP or MRCS, you can directly apply for a registrar position.
Thank you, sir.
No problem.
That was a truly enlightening session, sir. We are so grateful to you for taking time out of your schedule and for answering all our questions. Thank you once again, everyone, and thank you, sir.
No problem. Thanks. How many publications is good? Someone says. Even one is good. Depends. Okay. Okay. Thanks. Bye-bye. Have a good one.
Thank you, everyone, for joining.
Great session, was very enlightening. and we hope to think more it what's in the
Right. Thank you.
Thanks.
yeah.
So,
Thank you, sir.